In this video, we will discuss Pleomorphic Lacrimal Gland Adenoma. Pleomorphic adenoma is the most common epithelial tumor of the lacrimal gland. It is also called benign mixed cell tumor because it is derived from the ducts and secretory elements including myoepithelial cells. It is usually seen in young to middle-aged adults. On histopathology, the inner layer of cells forms glandular tissue that may be associated with squamous differentiation and keratin production. The outer cells undergo metaplastic change leading to the formation of myxoid tissue. Symptoms. Clinically, patients present with painless and slowly progressive proptosis. The tumor grows gradually and symptoms often develop over more than 1 year. Because the lacrimal gland lies in the superolateral orbit, patients may notice swelling in the superolateral eyelid region. Signs in orbital lobe tumor. Orbital lobe tumor presents as a smooth, firm, non-tender mass in the lacrimal gland fossa with inferonasal dystopia. Posterior extension may cause proptosis, ophthalmoplegia, and choroidal folds. Signs in palpebral lobe tumor. Palpebral lobe tumor is less common compared to orbital lobe tumors. It grows anteriorly, causing upper eyelid swelling without dystopia. It may be visible on eversion of upper eyelid. Imaging. CT shows a round or oval mass with a smooth outline and indentation but not destruction of the lacrimal gland fossa. The lesion may indent the globe and calcification may be shown. Treatment. Treatment involves complete surgical excision. Tumors of the palpebral lobe are usually resected along with a margin of normal tissue through an anterior orbitotomy or transeptal orbitotomy. Those of the orbital portion are excised through a lateral orbitotomy. Incisional biopsy should be avoided when diagnosis is suspected. Why is biopsy avoided? Biopsy can cause capsule rupture. Tumor seeds into the surrounding orbital tissue and it causes high risk of tumor recurrence and a possibility of malignant transformation. Surgical steps. The temporalis muscle is incised. The underlying bone is drilled for subsequent wiring. The lateral orbital wall is removed and the tumor excised, including a margin of adjacent tissue and periorbita. The lateral orbital wall and temporalis are repaired. Prognosis. The prognosis is excellent provided excision is complete and without disruption of the capsule. Incomplete excision or preliminary incisional biopsy may result in seeding of the tumor into adjacent tissues with recurrence and occasionally malignant change. To summarize, pleomorphic adenoma is the most common benign lacrimal gland tumor. It presents with slow, painless proptosis and inferonasal displacement of the globe. Imaging shows a well-defined mass, and the most important management rule is to avoid incisional biopsy.